Welcome to the WOVA Circle, real talk on fertility, wellness, and trying to conceive. I'm Gabie Peytchev, founder of WOVA Health and fertility educator. This podcast is your community space for navigating the path to parenthood with evidence based insights, authentic conversations, and genuine support. I'm dedicated to being here with you through every part of your journey. Welcome, everyone. In today's podcast, we have Dr. Rachel Hemphill as our guest. She's a licensed acupuncturist in California and is nationally certified as a diplomat of medicine by the National Certification Commission of Acupuncture and Medicine. She's a seasoned practitioner with nearly 15 years of experience, known for her commitment to bridging traditional and modern medicine to provide holistic, compassionate care. Welcome, Dr. Rachel.
Thank you. Thank you for having me.
Of course, I would really love to learn more about your journey. How did you get into acupuncture in the first place?
It's such a good question. It's something that I fought for a really long period of time. I was actually trying to go to traditional medical school, and I had a colleague that was just like, "Why don't you just go to acupuncture and Chinese medicine school? You have that background." And I was like, "No, no, no. I'm never doing that." And I actually applied for the application to the school that I ended up going to 5 years before I actually went. But when I was applying, I was actually living in New York City, and I applied to some schools there, and one of the, admissions counselor was like, "What do you think you wanna specialize in?" And I said something along the lines of, "Maybe pediatrics, maybe fertility." And she was like, "Great, I'm gonna let you shadow a fertility acupuncturist." And I had no idea who it was until the day of, but it ended up being Mike Berkeley in New York City, who is one of the top fertility acupuncturists, and he was just so nice to me, took me under his wing, and showed me, what a day in the life of his clinical work looked like, and I was hooked, and the rest is history. I applied to school, I moved back here to California, and then I started interning with another fertility acupuncturist who was Dr. Leong, who wrote the book on acupuncture and IVF, and she really taught me everything that I know today. So that was my path into fertility acupuncture.
That's so interesting. And it
Yeah.
highlights how little do we know about acupuncture,
Mhm.
all of us,
Mhm.
really.
Mhm.
So, can you tell us more about what acupuncture is?
Yeah, acupuncture is one of the branches of Chinese medicine. So I like to say that I'm a practitioner of Chinese medicine because when people come in for care with me, they're not only getting acupuncture, they're getting herbs, they're getting moxibustion if appropriate, nutritional guidance, lifestyle guidance. And so, what acupuncture is it is the insertion of thin, sterile needles into the body. What we're trying to do is elicit a therapeutic response with the acupuncture. I like to compare it to almost like creating a recipe. Everybody has some sort of imbalance or something that they need worked on, and we're trying to create a point prescription with the acupuncture points to tailor care to them to see if we can elicit a change in the way that they're feeling or some of the things that they're noticing and experiencing.
Many people assume that acupuncture requires maybe a short certification or a year of studying, but it does require way more training and education behind it. Can you tell us more about your education and what really takes to become an acupuncturist?
Yeah, I think most people are really surprised to hear that it isn't a short certificate program. It's actually a 4-year graduate level medical training. And so you have to have a bachelor's degree to go to acupuncture school. And most people either get a 4-year master's degree, which is full time, we didn't get summers off, or a doctorate degree. And then within that, you are not done. Depending on what state you're in, you have to apply for state licensure, and that always requires an exam to complete. And in California, we are known to have the hardest exam. So if you meet a California certified acupuncturist, then this is somebody that passed a really hard exam.
That's great. Yeah. So
Yeah,
everybody who comes in your hands is really in good hands. You know what you're
I hope
talking
so.
about.
I hope so.
What about fertility? I believe you have to do an additional certification so you can become a fertility acupuncturist because not all acupuncturists specialize in fertility.
Yes, that's correct. It's a postgraduate training. What I have is something called I'm ABORM certified, so it's the Acupuncture and TCM Board of Reproductive Medicine. And what that is, it was an additional postgraduate training of several hours, and then we have to go and we have to sit for an additional exam.
If someone is seeking acupuncture during their trying to conceive journey or maybe during IVF, what should they look for when choosing the right practitioner?
That's such a good question. I really think that that question is individualized. I think you can find, the top fertility acupuncturist in your area, but if you meet them and start working with them and it's just somebody that you don't feel like jives with your personality or you don't like the advice you're given or how it's delivered, then that's not going to be the practitioner for you. So it really has to be a combination of personality matching, in my opinion, but also asking the person what their experience is with fertility care. They don't necessarily have to have the ABORM certification, but what are their postgraduate trainings like? Do they understand what IVF protocols are? Do they have a basic understanding of menstrual cycle physiology? Have they worked with recurrent pregnancy loss? Do they have, additional certification or understanding in prenatal care? Those are all things that are really, really important to ask.
I would advise people to try different acupuncturists if they don't really find a good fit with the first one. If you like your first practitioner, then perfect. But I initially went through multiple acupuncturists also because I was trying to get the coverage from Kaiser. And it was hard to find the right one. And there were different different situations really. In some places it was very crowded and loud. In other places it was not dark enough in the room. So how are you supposed to relax? There were also acupuncturists who didn't really have that fertility training or education behind. So I think it's very important to find the right one.
Mhm. It really is. And so often I will meet with somebody that has met with other fertility acupuncturists and that's always my question, like what wasn't working and what can we change here? And it can be a variety of things, whether like exactly what you were saying, the clinic was too noisy, it wasn't warm enough. I felt like the person was yelling at me. The person yelled at me for my outfit when I walked through the door is a
Oh my
complaint that
God.
I heard from somebody. So there's a variety of things. And I mean, we all make mistakes. But we're all here to learn and of course make the patients as happy and comfortable as possible.
Yeah. So if we look into the research, you can find kind of mixed evidence. There are some studies that confirm that acupuncture does work and supports fertility, but there's conflicting studies too. And
Mhm.
why do you think that's the case? Do we just not have enough funding?
Honestly, we could dedicate a whole podcast on this we could talk about this endlessly. I think one of the biggest issues is trying to fit acupuncture into the current research study model. It just does not work. And one of the reasons why is you can't standardize acupuncture and compare it to a control. It's impossible. Acupuncture is multifaceted, and patients are treated at an individual level. So, somebody coming in for fertility support that sleeps well versus somebody that comes in for fertility support that maybe has poor digestion is going to get an entire set of different points between the two of them. And so, what we have with acupuncture studies is we have a standardized set of points that is used on patients. And not only that, sometimes the dosage of the number of treatments that the patient gets in the study is not something that we would recommend. I think one of the most popular studies and famous studies about acupuncture when it comes to IVF is the Paula study that was done in the early 2000s. It was 2 sessions before and after embryo transfer. Um, and honestly, that's just not enough acupuncture to support somebody in an embryo transfer cycle. That's one issue. You bring up a really good point about funding. I mean, acupuncture, we're not going to have large pharmaceutical backers. And when we don't have something like that, we're not going to be able to fund large center studies. Most of the studies are small. And so to answer your question, it's really like fitting a round peg in a square hole, it doesn't work. And of course, if we're not able to study acupuncture in the way that it's meant to be practiced, we're never going to show the results that we're hoping to show.
So that's really interesting. So, in your experience, how much do you think acupuncture helps? This really is boosting the fertility by 50% or 80%. Or this person has been trying IVF a couple of times and now he's doing acupuncture and trying herbal medicine and changing his lifestyle, nutrition, and working with you. And all of a sudden they're pregnant. What have you seen in your practice?
Oh, so many things. I don't even know where to start. I think most fertility acupuncturists will tell you that our most exciting cases and the things that really get us, we're like, wow, that really worked, or the people that are told that they're never going to have kids. Like, you're never going to have a baby, you're never going to get pregnant. And then, of course, they conceive with acupuncture and herbs and some of the lifestyle changes. So often, as fertility acupuncturists, we're preparing somebody for their first IVF cycle, getting them ready for retrieval. They're about to order their meds. And I can tell you, I mean, I've had numerous people tell me right before they hit order on their meds, hey, something really weird just happened. I had a positive pregnancy test. What do you think? It happens all the time. So those are the great wins. So often too, I mean, most recently I had a patient that was told she could only conceive with a surrogate. And then, of course, looked for a surrogate, had a surrogate, was about to do the transfer with the surrogate, only to get pregnant on her own.
That makes me think. I was reading in the National Institute of Health, they were talking about how chronic disease can be highly prevented because about 70 to 90% of chronic disease is due to environmental factors, including lifestyle and nutrition. And I was also thinking that infertility is categorized as a chronic disease, and we cannot oversimplify and say, oh, 90%, if you improve all of this, then that's going to boost your success rate by 90%, because there's other factors like age and fertility is complex. But I'm thinking it really is quite a big boost if you optimize your health
Mhm,
by working with the right practitioner, getting the right coaching. You can really boost your chances for natural conception and IVF. And I've
mhm.
seen this many times as well, including with my own journey.
Yeah, yeah.
I
No,
was
it's
also
it's really true, exactly what you're saying.
I was also thinking some people are a little scared of acupuncture. And if somebody comes to you and say, what else can you offer? Do you think that in certain situations you can skip acupuncture, or do you think that it's always going to be good to bring it together with everything else that you're working on?
Yeah, that's such a good question. I mean, I will always try to convince the patient to try a couple of acupuncture points when they come in. Um, and then what I talk about is just like, hey, well, let's start with some of the points that are great for calming, and we can work our way up to different points. And a patient that is really needle phobic or afraid of acupuncture, I'm going to walk them through each session. And, of course, if something is a non negotiable, I do not want that point in that area in my body, then we won't use it. I want to say that the best representation of your question of a patient that I had was it was actually a male fertility patient. He grew up in a country where acupuncture was, very much used for pediatric use. And he was telling me that he was actually forced to get it as a kid. And apparently, I guess he was being held down while they were doing the acupuncture, and it was a childhood trauma for him. And he was just like, I just can't do it. I can't do it. For somebody like that, I actually gave him a TENS unit. And what I did is I gave him a point prescription that he could use for male fertility at home. And then, of course, check in with me, see how you're doing. And that worked for him.
Oh, good. So you're bringing
Yeah.
up male infertility.
Yeah.
So can we briefly talk about this, how acupuncture and basically whole body health can support male fertility and why male fertility is also very important?
Yeah. Yeah. I mean, males are make 50% of the equation. They're making 50% of the embryo. So they definitely need to have their health in tip top shape. But I want to say that the treatment mechanism for men and women is pretty similar in Chinese medicine. I know the equipment is different and of course eggs versus sperm, but what we're trying to do is optimize blood flow to the pelvic area to improve sperm parameters. That's one of the top things, in addition to helping with stress management, helping people sleep better. Those are all things that are really important for male fertility.
I'm curious between women and men, what do you see are usually the top priorities or the issues that they're dealing with that are really blocking conception?
I wanna say stress and anxiety is probably number 1. I think in the Bay Area, we're just prone to having these really high achieving men and women. They have very stressful jobs, it's expensive to live here. Those are really the top issues that come up. People don't sleep well. If you don't sleep well, you are, of course, messing with your entire digestion, your hormonal cascade. That really has to change. And then, of course, poor digestion. And then, of course, poor blood sugar regulation, where people are skipping meals, eating on the go, or, you know, eating things that are not making a complete meal.
You mentioned women often come to you after they've been told they cannot conceive, they can get pregnant on their own. Why do you think that's the case? Who tells them that? Is it the experts out there, the doctors that they're working with?
That's a great question. I also asked that question. It's a variety of people. It's maybe an OB tells them that, "Hey, this hasn't been going well, you might wanna be thinking about donor eggs," or I know that a lot of doctors use an equation where they plug in your age, of course, your hormone levels, and then that will dictate a percentage of success for the patient. But, of course, I always tell a patient, it's like that you can't just say age, hormone levels, and give everybody a percentage because it's not looking into other factors of your overall health. Yeah.
Yeah, it's generalizing a lot, and it's really focusing on age. And this is more in terms of how we used to think about fertility. We used to think that age is really the primary factor, and you can't really do much about it. But more and more research is coming out to say that okay, it's not just age. If you're still ovulating, if you're not, even in early menopause, you might still have some eggs left, and you really need one healthy egg and a healthy sperm. So when you're approaching, I guess, menopause, maybe you're still in perimenopause, because a lot of women nowadays and men are delaying childhood. This is really a time where you have to really focus on egg quality and sperm quality because you have less to work with.
Mhm. Yeah, and everything that you're saying, I mean, we're talking about age being such a factor that decreases somebody's chances of conceiving, but what we're seeing is that the largest group of first-time moms are women in their 40s. That's what all the data is showing right now. So,
Yeah, yeah,
yeah.
exactly. Are there any recommendations for people who are going through IUI or IVF versus those who are doing natural conception?
Yeah, like what is the difference in treatment for these patients?
Yes.
Or okay, yeah, great question. For the most part, at a core, you know, basic guidance, both are all 3 are treated the same. We're trying to reduce stress, increase blood flow to the pelvic area. But depending on whether or not somebody is using medication, we also want to add points that are going to help mitigate some of the side effects or some of the issues that come up with some of the meds that can be used in IUI and IVF cycles. So often bloating is something that comes up, headaches, hot flashes, trouble sleeping, um, changes in urinary and bowel habits. Those are all things that we add to the treatment when patients are going through processes like that.
And when is a good time to utilize acupuncture during your IVF journey?
Yeah, great question. There actually is any time is a great time. There isn't a magic formula or a magic time. What we really stress as fertility acupuncturists is more is more. So the cumulative effects of acupuncture are going to be more beneficial than just having one treatment around your embryo transfer. So anytime is a great time to start. I think some people get nervous that they're starting too late or they didn't get enough acupuncture in. Sometimes I'll get somebody that will start and they're already on day 5 of their stimulation. And what I will say is some acupuncture is better than no acupuncture. So starting whenever you can start is a good time.
And how long do you continue? Do you continue post transfer in early pregnancy?
Yeah. So yes, we want to see the patient once a week through the first trimester. It's really helpful for blood flow, implantation, really nourishing a new fetus. Also, taking care of any of the side effects that come up or symptoms of pregnancy like nausea, trouble sleeping. We all want to work on those with the acupuncture. And then I let people decide and how frequently they want to come in the second trimester. Some people come in every other week, once a month. If something comes up, I want to see them more frequently, like if they're having trouble with their back or sciatica. And then depending on what their delivery plan is, I will cater a treatment plan to them. If they're preparing for a C-section versus if they're trying to do a vaginal birth, we'll change the treatment protocol. And usually they come in once a week or yeah.
Do you see mostly patients who are going through fertility treatments, or do you also see a big percentage of people who are just trying naturally? Because in my experience, I didn't find out about acupuncture and how it supports fertility until after I went for an IVF.
Mm. I see patients in all spectrums of their fertility care. I'll see patients that are in the preconception part where they're just wanting to get some information about how to get their bodies in the best optimal condition before they start trying to conceive. Those patients, we want to look at what their cycles are doing. Does this person know how to track ovulation? How are they planning on tracking ovulation? When are they planning to conceive around what the ovulation information is giving to them? Yes, I'll see people who are going through IUIs. I'll see people going through IVF. I'll also see gestational carriers that are preparing for transfer, and the intended parent sometimes needs to come in because this is such a huge, stressful undertaking to, of course, go through the transfer process with another person. I'll see anybody in any aspect of their fertility care.
That's really good to know. That means a
Yeah.
lot of people are more aware ahead of time and are more proactive when they're
Mhm,
trying to conceive.
mhm.
What outcomes or changes do your patients commonly see when they pair acupuncture with IUI or IVF?
Yeah, great question. Well, of course, the outcome that we're all shooting for is I want them to take home a baby. That's the main one. But I will say overall, what I'm really looking for is does the patient feel like acupuncture had an impact on the whole experience, the whole fertility experience, a positive impact. And that positive impact could look like, hey, I had very little to no side effects when it came to using the IVF medications. I slept great during the entire cycle, or I felt really calm and stress and anxiety free during my entire cycle and into the transfer. Those are things that I think are really, really important.
This was also something I noticed during my acupuncture treatment. I did acupuncture during the IVF journey, post IVF, and in the first trimester of pregnancy. And it definitely eases the emotional pain, I'd say. It definitely reduces stress. It's one of the few things I truly enjoyed and loved during the journey, because when you are going for infertility treatments, and unfortunately, a lot of times you are not really prepared well, and not all doctors are, I mean, I'm sure they all have good intentions, but not all of them are a good fit. I'd say that. So, not all of them are so compassionate and empathetic. And it took me a while to find the right fertility doctors. And the journey can be really emotionally draining, physically draining. It's really, really hard when you go through this. Acupuncture was really like a lifesaver. Like, it really changed things for me, because this is the one time when you can truly relax and be on your own, be,
Mhm.
and it really gives you that sense of calm. I really enjoyed it.
Yeah, yeah. And I think too, I mean, so many patients go through the cycles alone in my experience where they're not sharing with friends and family for privacy reasons. And I think so often as acupuncturists, we have this job of not only being the clinician to help with symptoms, but we really are, somebody that is holding space and a companion throughout the IVF process, whether you have concerns, you're scared, you're not having the cycle that you thought you were having. We're always here to listen.
And that's very needed.
Yeah.
We moving a couple of questions back. You mentioned ovulation. I know a lot
Hmm.
of women are always asking, am I ovulating? When is ovulation for me? And I mean, for years, we've been told the average cycle is 28 days and ovulation happens on day 14. And you go online and you do all these different calculators, and people think, okay, this is my fertile window. I'm ovulating on day 14. But can you explain why this is really not the case for most women? And it varies quite a bit, even from woman to woman, but also from cycle to cycle with the same woman.
Yeah. That comes up so frequently in practice, you'd be surprised. Whether I'll have somebody come in and they're actually counting their menstrual cycles completely incorrectly, where they're counting their first day of their cycle as the last day of their bleeding. And so when they're actually starting testing on day 19, if you think about it, because they're behind 5 days, and they come in and they're like, "I this isn't working for me. I'm not ovulating." And lo and behold, just teaching them how to test initially for a larger window, maybe start on day 10, and test through day 20 and see what happens, see where your positive is, and then go from there. But yeah, it's nice to tell patients that there is no normal when it comes to that. If you're a day 10, day 12 ovulator, I would not worry so much about that. We're gonna optimize and maximize what you have. But yeah, there's no normal when it comes to cycles.
My cycle, for example, have always been about 25, 26 days. And when I tested when I'm ovulating, it was usually around day 9 or then day 10. So if I was following that traditional approach of thinking day 14, I could have really missed that fertile window of
Yeah,
five
I mean,
days.
how did you figure that out?
I had to take a test, and obviously there's different tests. There's the LH search test, which can tell you supposedly when you ovulate, but it doesn't really confirm ovulation. So there's
Mhm,
other
mhm,
tests where that you need to use to even confirm ovulation, because you need to look at other hormones besides LH. So that's how I confirmed. And then eventually also when I was doing the treatments, and they could also control and see if I'm ovulating or not, and they could trigger ovulation and so forth. But
mhm.
when I was
Yeah.
doing IUIs, initially I was doing natural IUIs. I decided to try without hormones first. So yeah, I was tracking this, but a lot of women don't really know. Even if you do the LH surge test, you think you're ovulating, but you might not be ovulating, and you could still have a regular period and not no real signs.
No, exactly, and those tests aren't for every woman. My PCOS patients, those LH tests will absolutely not work for them. They'll always have a positive, and what do you do with that information, you know? So there are many things that are on the market that we can utilize. There's actually a test that look for progesterone that you can confirm ovulation that way, called the PROVE test. There
Yeah.
are many, many devices on the market that are pretty great, like the Mira, where they're actually tracking all four hormones, your estrogen metabolites, your LH, progesterone, and FSH. So there are many, many things that I will recommend to patients depending on what their picture is.
Do you ever talk about also the fertility awareness method, where you can also track the basal body temperature, the cervical fluid?
I do sometimes. I do find that that method is difficult for my corporate hardworking patients because you really have to be nuanced at when you're taking your temperature every single day. And sometimes people want to sleep in on the weekend and you miss a whole data set by not tracking correctly on the weekend. I will say that there are devices on the market that you can purchase that could help. Although they're tracking skin temperature and not basal body temperature, it's still a good way of practicing that method without feeling like you're held to the same temperature every single day.
Awesome. I love it. I love that you have different approaches depending on what the person needs and can really accommodate in their life.
Yeah.
Now, what about when you are struggling with diminished ovarian reserve or low AMH? How do you support someone with that kind of diagnosis? Is it any different?
No, I think the one thing that I just wanna make sure when somebody comes in with, "I have low AMH," or "I have low FSH," I just wanna make sure that that patient understands that that's a mark of their ovarian reserve, and that isn't a predictive number that is going to tell them whether or not they can have a live birth. They actually have found that that is not a predictive number at all. It's actually a number that is really important for, your reproductive endocrinologist if you're doing an IUI or an IVF, because it tells them, what dosage of medication they can give you to stimulate eggs for you. Um, that's the first thing I tell those patients as a framing for their treatment. But it really is not so different. Again, still working on optimizing blood flow to the pelvic area, working on calming stress and anxiety. I will recommend that patients that have a lower reserve, we're always trying to optimize what's there. So increasing their intake of antioxidants, whether it comes to eating more fruits and vegetables, um, supplements that support antioxidant support is really important. And then, of course, looking for things that might be in their daily life that could be working against them when it comes to having the best quality eggs. Things like endocrine disruptors in their house, having them look at their shampoos. Are you cooking with pans that are fertility safe? There's a variety of things that I will give patients as a list just to make sure that, hey, we're optimizing your chance with a low reserve.
I really love how knowledgeable you are because honestly, like nobody really talks about these things enough. And unless you've struggled for a while, you usually don't even think twice about, endocrine disruptors, for example. And going back to low AMH, I from my experience, when I was told that I have low AMH and diminished ovarian reserve. So initially, when we were diagnosed with unexplained infertility, my numbers were fine, and then a few months later they dropped. I think after the first IVF failed, my numbers dropped, and I panicked. I was not explained like what you just explained, that low AMH, that AMH in general is really more of a it's helping you really, it's helping the endocrinologist or the fertility doctor understand how you're going to respond to the IVF medication. And if
Mhm,
you're a poor responder, and that should have been explained to me, then maybe you might end up having more than one treatment. So I didn't have to panic after my first IVF failed, and I didn't have to feel like I'm less of a woman, less of a human
mhm,
being, and that I
mhm,
cannot get pregnant ever naturally. I was even offered an egg donor, the possibility of start thinking about an egg donor,
mm,
which I think like right now I feel it was so premature.
mm,
And yes, and I didn't know that, and I thought, oh my goodness, my egg reserve is like really dying. I don't have any eggs left, and I'm still 35. Why is this happening? And that's additional stress. If all of this was explained to me properly, I was gonna have much more hope and positive thinking, and I was not gonna be freaking out if I knew that this didn't really interfere with natural conception, that it wasn't a predictor, and that if I was doing IVF, I just have to keep in mind that it might take a couple of protocols until they find the right one.
yeah, yeah. Everything that you said, I mean, I think that we are really lacking when it comes to women's health, and of course, having women test maybe in their 30s just so they can have a benchmark of what their ovarian reserve looks like. I had a 38-year-old woman that I worked with years ago that came in and her FSH was 15 and I think her AMH was like point 0.3, point 0.4. And what she had said to me is that, if I had known this earlier, I would have chosen so much differently in my life, whether I would have done egg freezing or I would have moved to IVF right away with my partner and we would have banked embryos just to ensure that we could have the family size that we desired.
Yeah, yeah.
Yeah.
Hopefully, more and more of this knowledge is going to come out there and help people, and that's what we're trying to do today as
Yeah.
well.
Yeah.
So people are more prepared, and there are experts who can support you on this journey. So please reach out.
Mhm.
Don't be scared. It's I mean it's completely normal, just like anything else. If you're experiencing any kind of trauma or injury, you're gonna reach out to a specialist. And Another thing I was reading recently that it made me think. Usually, if you're struggling to conceive for 6 months or a year, depending on your age, you are labeled infertile. But we did talk about how if you're not tracking your ovulation correctly, if you're not having intercourse during that window, you might not be getting pregnant because of just simply that. So, not all cases, women and men are necessarily infertile. I mean, there
Mhm.
could be situations when there's just a few tweaks that you need to make, or you just need a little more education behind what's going on with your body and your cycle. Would you
Mhm.
agree?
Yeah, I think it's unfortunate that the how things are currently set up is that they want you to fail for a period of time before somebody is actually allowed to step in and help you. That's really unfortunate. Um, and sometimes when depending on the patient, there are some patients that with a few tweaks, yes, they will get pregnant. They're just missing something. They're missing part of the puzzle. But then there are those patients that unfortunately are in a critical spot. Like they have a diminished reserve and you're making them wait another year. Or, their partner has a diminished low sperm count and you're making them wait another year. And some of these things that are causing maybe the low sperm count are something that needs a surgical intervention. So you're actually creating more of a time for these patients to go without care and interventions than they need to.
When do you think people should go ahead with IVF? At what point? Are there any specific situations when IVF is inevitable or recommended?
I think patients that have blocked tubes, absolutely, IVF is the route to go for you. I think that I don't ever push IVF as a treatment if a patient doesn't want it. If a patient comes in and, they're recently married and we find out that they have a low reserve, like a low AMH, I am going to recommend maybe they consider talking to an IVF doctor to bank embryos if they're wanting to have more than one child. It just really depends on the patient, but I know that many patients are afraid of doing IVF and they are adverse to IVF. And so I don't ever want to recommend that as a first line of treatment if that's not in line with their family building goals.
Hey, why do you think people are afraid of IVF? I'm curious, like from what stories you've heard, what do people share?
Yeah, they've heard anything from like, the medication was really, really, really tough on me. A lot of my patients have backgrounds in either post traumatic stress, generalized anxiety, clinical depression. And one of the things that they're really, really worried about are there going to be emotional side effects for me when I'm going through this process and taking these medications? That's the number one.
I'm sure every journey is different. I think I was lucky enough, or maybe because I've also been studying whole body health and I've been trying to really be healthy during this process. But the medications didn't really have a big effect on me. But I know for some women, they can really cause a lot of emotions and mood swings. And because, I mean, you're taking hormones. But I was probably lucky. I did 3 treatments. Yes, there were a few times when I felt like I was a little more emotional, but overall it was okay for
Good.
me at least.
Yeah, I'm glad to hear that. Yeah, I mean, one thing too that I do tell my patients is that IVF continues to change and evolve. When I first started practicing, really the standard of care was to give the maximum amount of dosage of the IVF medications to all patients. And that was really hard. That was really hard to see on the patients. But that really isn't the case anymore. We're finding more and more that lower doses are actually optimal for most cases.
And I add here researcher clinics because there are still some clinics that are not up to the latest research and they're still using those hard protocols on you. So I would definitely advise people to do some research ahead of time.
Yes, no, you're right. You're exactly right.
When someone begins working with you, can you share what the first session usually looks like?
Yeah. I like to say that the first session is just an easy conversation between two people. I give every patient some detailed paperwork to fill out before they come in. And it's all about their health history. If they've completed IVF or IUI cycles, I want to know the outcomes of those. We want to talk about their lab tests. If they're currently partnered with someone that produces sperm, I want to see if they've had a semen analysis. I want to know what their lifestyle is like. Do you exercise? What do you eat? What's your breakfast, lunch, and dinner look like? What does your community look like? Who do you go out with? Are you close with family? Are you close with friends? Are you currently seeing a mental health therapist? All of those things. It's an hour long, and I will, of course, go over what I think is a fair treatment plan for them and what they should expect to see with working with me in the first couple of sessions.
You mentioned a lot of your patients have some past trauma that they're still dealing with. Do you approach them any different? Are there any specific recommendations that work for people who are under a lot of stress and they have some serious past trauma that they're dealing with?
Yeah, it really depends on what the past trauma is. If it's something with past trauma where it's sexual past trauma, I'm very, very careful with how I approach the patients in terms of how I drape them in the session. If I need to remove the drape and access their legs or their low abdomen, I want to be very clear and articulate about that. Like, is it okay for me to needle your abdomen today? Um, that's the one main difference I'm working with those types of patients. For everybody with stress, adding points that are really helpful with reducing stress. I always want to hear about what their stress is. I think I don't want to just get them on the table and put points in and reduce the stress. Sometimes it just helps to have somebody listen to what was stressing you out in the moment or what happened to you this week that is contributing to your stress. It has to be a combination of those things where, therapeutic talking, but also we're going to do some therapeutic treatment for you as well.
For someone listening right now who feels a little overwhelmed or unsure where to start, what's one piece of guidance you'd want them to take away?
Yeah. I think it could be really overwhelming to find your practitioner or, just from looking at an internet search. I will say that most fertility acupuncturists will do a 15-minute consultation with you for free. So I think it's important maybe to access that as a resource first and foremost. Book a couple of those with a few practitioners in your area. Talk to who you feel like is the best person to work with, and just start and make that consultation. So often the feedback I get is like, "Oh, I really wish I did this earlier. I wish I did this earlier. I should have started earlier." So definitely don't be that person. Don't be afraid to start. Just start somewhere.
Where can people find you or book a session with you?
Yeah, so I am in Oakland, California, and then you can find me through my website, citypulseacupuncture.com. You can contact me directly on the website, or you can also book an appointment online.
Do you work with people virtually when it comes to everything else but acupuncture, lifestyle, herbal medicine, nutrition?
Yeah, I do. For if you're in the state of California, I absolutely can work with you virtually. So yes, we can do things where I can send you a supplement prescription. I can send you herbs in the mail if you're unable to come to the clinic, and of course, I'm always giving lifestyle, nutrition recommendations.
Amazing. Thank you so much. That was a very interesting conversation that we had, and hopefully educational as well for people, and inspiring and empowering, because that's really the goal, that we empower you with enough knowledge so you know how to be proactive in your preconception care and how you can boost your chances of getting pregnant, but also having a healthier pregnancy and healthier children and living longer so you can be around your children for a long time, see them
Yeah.
grow and be together
Yep.
longer.
Mhm.
Thank you. Thank you, Dr. Rachel. It was great
Thank you
talking
so
to you today.
much. It was good. Always good to talk to you.